PSCS stands for P10 hamartoma tumor syndrome. And it's an umbrella term for clinical conditions that we previously could clinically recognize. And at a certain point in 1997, if I'm correct, the P10 gene was discovered, and we discovered that these clinical conditions were all due to the same genetic mutation, or at least the same gene, P10, and that all these patients had mutations in the P10 gene. The P10 gene is what we call a tumor suppressor gene. It means basically that it is involved in the regulation of growth of cells, and it's a bit a brake on the growth. And we have all 2 P10 genes, so everybody has it. And if you have the hereditary condition, then one of the P10 genes has a DNA change, and that's why that gene is not working well. And that is taking the brake off a little bit. And it makes that the brake can go off and you can develop benign overgrowth, but also you can develop cancer. That also means that if they get children, they will give them half of the DNA. So they will give either the gene with a normal DNA code, or they will give the gene with the mutation on it. So that means that it's a dominant inheritance pattern, and that every child has a 50% chance of inheriting the mutation. What we do see quite often in P10 is that somebody has the mutation not inherited from his parents, but a novel mutation. We call that a de novo mutation. We do see that quite often in P10. So patients have manifestations of all different kinds. So there's, it starts in childhood with sometimes developmental problems. They can be delayed, mostly motor development. They can have a very large head circumference. So that's one of the things that the doctors can notice in the beginning. But when they grow up, they get more of the overgrowth, benign features, and also later on they have a risk of developing cancer. If we look at the cancers, then it's quite diverse, but the highest risk is for breast cancer. And we often see that women even get breast cancer twice. Then they can get thyroid cancer, and women can get uterine cancer, so cancer of the uterus. Those are the main cancers, but also colon cancer can occur, melanoma can occur, renal cancer can occur. And then we have a lot of benign features that most of them are not really harmful. But for example, the vascular malformations can be painful and also difficult to treat because they can reoccur also after treatment. But also they can have a lot of, well, papules on the skin or on the tongue that are also a sign of benign overgrowth. Lipomas, so that's sort of fat that's underneath the skin. And other hemangiomas or vascular malformations can be present. Yeah, we are very much trying to figure out how to best make people aware that patients can be recognized before they get cancer. And that's not so easy because it's so rare and there's many rare syndromes. So we know red flags. We know if somebody has a large head, if you look in the mouth and they have a lot of papillomas on the tongue, and if they have a bit of a large thyroid gland, then that's really, really red flags for P10. If you know it, you can recognize it. So I think the way we see it in the genetics clinic is that if you know that you have a high risk, then you can really do something. And that can make a lot of difference for your own health.